Mr. Speaker, Senate Republicans are making Donald Trump's big, ugly bill even uglier, with steeper cuts to Medicaid that will leave more kids, parents, and seniors without health care. Also, they can reward their billionaire donors with even bigger tax breaks. This bill would deeply cut Medicaid and hurt our most vulnerable. Don't take my word for it. Republican Senator Thom Tillis shared this chart on the state-by-state impact of the Senate Republicans' newest cuts. Do you live in North Carolina? If you do, you stand to lose $38.9 billion and could kick up to 600,000 people off Medicaid. Many states, including Republican states, will lose tens of billions of dollars in Medicaid funding. How about Virginia? Virginia will lose $24.8 billion. Louisiana, the Speaker's home state, $20 billion. South Carolina, $20 billion. States with small budgets would get hammered. Iowa loses $4.1 billion. And Senator Ernst from Iowa, what does she say about it? She's not concerned. She says, well, we're all going to die anyways. Kentucky loses about $12 billion. What does Senator Mitch McConnell have to say about that? He says, you'll get over it. What? Are you, the American people, going to just get over losing your health care so that a billionaire can buy a bigger yacht? Do you want to die young in the emergency room so that a Fortune 500 company can add a few more seats to their private jet? Here's what Senate Republicans are doing that caused Senator Tillis to make this chart. Right now, states use a variety of tools to help pay for their share of Medicaid, which is the health insurance program for low-income families, children, seniors, and people with disabilities. One of those most important tools is called a provider tax. That's when hospitals or health plans agree to pay a small tax to keep Medicaid running. In return, the federal government matches those dollars. It's a federal-state partnership that keeps hospitals open, staff paid, and patients covered. But the Senate Republican bill would limit how much states can use that tool. It puts new restrictions on states that expanded Medicaid to low-income people, saying they can't collect as much from hospitals or health insurance companies as they do now. It means the federal government would be telling states, you can't use the money you've depended on for years to keep Medicaid going. And that's going to cause a lot of damage. Hospitals would lose funding. States will face bigger budget gaps. And then what happens then? You'll see cuts. Cuts to health care, cuts to services, cuts to the very people who need the help the most. This means tens or even hundreds of billions of dollars lost. That's not just numbers on a page. That's real people losing health insurance. That's real patients getting turned away, real communities, especially rural and low-income communities, being left behind. Now, this morning, the Senate parliamentarian ruled that these provider tax restrictions cannot be included as drafted. But this fight is still very real. We have seen Republicans rework the text of these radical cuts to get the parliamentarians' approval, and at least one House Republican just today suggested they just ignore what this parliamentarian has said. I have no doubt that the plan Republicans come up with will slash Medicaid and devastate hospitals to fund their tax breaks. Now, a few Republicans here in the House have said these new cuts, they go too far. But are they really willing to stand up for their constituents and vote no if the Senate sends these deep cuts? I'm not going to hold my breath, because Republicans have already caved last month and voted to kick millions of people off Medicaid. House Democrats and Senate Democrats are united to stop this big, ugly bill. I urge Republicans in Congress to join us to do the right thing and oppose this bill. Stand up for hospitals. Stand up for patients. Stand up for the millions of Americans who count on Medicaid every day. I yield back.